Tugenda tukole nanongo kati Sharon ebifaananyi agenda bikusanga nabyo.
That wait for the gloves and what in that situation where I waited for the gloves, I gave birth without operating me. They told me that, hey, you were a very good girl. Thank you. They told me that I'm going there to the women's where they gave birth very well. They took my baby to the Nicu. After for the theater, I asked them, where is my baby? Where's my baby? I was feared. They brought me there in the Nicu. They told me that your baby is here. Even I found there his name and my name on his chest. I said, eh, this is even my baby. I really thank the doctors like Nurse Robert. He taught me how to breastfeed the baby, and other nurses taught me how to clean the umbilical cord. There is the time where they told me that the baby's umbilical cord in very bad situation. We are going to Kawempe again. I cried very much. I told them that Kawempe is very far. The money is over. They told me you are going to Kawempe for the umbilical cord. There is a doctor, I don't remember her name. She came and helped me every day, every time we came. Nga tuja musawa 2-5-8 ngeze sawa zonna omusawa mbeererawo nanongooseza omwana wange. Neebaza abasawo bonna bansomesa kangaru buli kimu nembiyiga abasawo bonna kubanga nali ngambagamba nze njagala genda ng'omwana wange bangambye amalaweza kilo 3 because namuzaalira mu kilo 1. Ne tubeerawo ebbanga twabeerawo omwezi nga mulamba ne bangamba omwana oyo aganyoweza kilo 3 ogenda neera Kawempe. Ne bagamba musawo nkola ekisoboka kyonna naye omwana agaanye. Ne bangamba togwa mu maanyi, omwana wo mwana mulungi talina buzibu n'akamu. Wabona n'ekiseera kyatuukira ddala nga ndabira ddala ngudde n'eddalu olw'omwana ono nga taliweza kilo 3. Every time ng'abeera mu kilo 1. Naye neebaza abasawo bonna, neebaza ne Katonda okumbeererawo. Mwebale nnyo, mwebalire ddala. Neeyanziza nnyo neeyanzinga abasawo ba Mukono General Hospital. Najja wano nga nzize mu scan. And they told me, genda mu labor because we see you are not in a good nga toli mu mbeera nnungi. Bwe natuuka eyo ne baŋŋamba ofunyeemu obuzibu naye ono omwana agenda, you are going to Kawempe. And my mother said, hey, Kawempe, that the money is too much. They told me, no, don't worry, you go with an ambulance. Some people there collected for me money for the ambulance. But I was in a very bad condition. They took me to the labor. I reached there. I was in a very bad condition. They sent me to the theater. They told us to sign the money. We went. After reaching, I have a lot, but I have few minutes to speak. But I'm really so grateful. Thank you, Dr. Kasirye, for being there for us and helping mothers to see that we go through a successful experience. Amen. So compassionate, so good to us, and also the fact that there were facilities, we had things that they were helping us with, and I felt so much humbled that I just feel emotional. I'm sorry, I feel emotional. But I thank you people for helping us. Having our baby being alive, having a premature baby is a challenge. She was my firstborn. I had no any experience. Was my firstborn, and even after when they were about to send us off, going back home, she got other complications, and she was really so much not in a good life. But they took care of us. These guys, they can love, they can take care. They were so much present. I want to thank Dr. Nurse Betty. They would move up and down. She doesn't rest until she sees that there is a difference. I could see her, like she could even fail to eat lunch, they give you their whole heart to feel like you are really attended to. I felt so loved, I felt so cared for. I really thank God. I had lost hope. I had really lost hope. I saw my baby, she even started, the feet started getting cold, like I really felt like she was dying, but they tirelessly worked with other doctors, Dr. Chigonia. Yeah, I can't forget you spoke to me, you encouraged me, you were like, she's going to be fine, she will be well. But I believe they also reached a time there, man, this girl is going. This girl is going. It's also a nutrition. My kid, I gave birth to this kid when she was 7 months. So my being here, I would really want to thank first of all, the organization of this, the leadership of this hospital, maybe, and also the government at large, and also the Save the Children organization. I was really so helped when I was at the Nicu there. I want to thank these ladies who work in that facility. My goodness.
Let me leave that story apart, and I invite the director, Save the Children.
To end by also thanking government. The DG is here. We have really had affirmative action in terms of this hospital, and we are really grateful for that. We are aware of what you are cooking from Mukono, and I want to assure the people of Mukono that government is very much aware of the gaps we have and really committed to closing most of them. I want to thank you once again and congratulate ourselves for this specialized facility we are going to commission today. Thank you. Like this hospital, because the infrastructure challenges are very clear, and across the district we also have staffing challenges. But you see, when you have challenges, there are those ones you can handle, there are those ones you escalate to other levels. So as a district, we are also committed to deal with those challenges that we can handle, that we can deal with. And one of them is trying to reduce on the staffing gaps. because like Nicu has said, we have some resources. We have some resources to recruit some cadres, and that's what we are going to do to ensure that we may not cover all the gaps, but certainly we are going to have some recruitment so that we close some of the gaps. Kale engeri gye tuli ku mukolo gwa neonatal, okwebaza abali mu neonatal. Mwemuli wano? Yes, I have been there. When you look at what goes on there, olabira ddala nti life is being manufactured there. And the last time I was here, I was told that our survival rate is almost 100%. Which is really very commendable. So thank you so much. Naina abasawo abalala for really working and ensuring that we give the quality services to our people. Now generally, of course, we are having buli kaseera abantu bano bagezaako okulaba ki kyetusobola okwongerako, and I really want to thank you so much. Kubanga era neeno gye tugenda okuggulawo abagambye nti kyali something else, naye ne bagamba naye katukikyuse kifuuke kikiri. Naye ng'oggyeko ekyo n'okunoonya wa we tusobola okufuna abatuyambako. There has been a lot of efforts and really sourcing for people who can support. When you look around, the number of partners who have made contributions, even in the infrastructure around here. So I really thank you so much. I don't know kwebaza n'abasawo. Abasawo kubanga balina kinene nnyo kye bagasseeko. Many innovations, the innovations that have taken place here is a result of the efforts of the leaders of this hospital. Era mwami Dr Kasirye, administrator mwenna, kambeebaze n'okwebaza bannammwe be mwasikira, kubanga abantu abatunuulira eddwaliro lino okuva emabegako Dr Kasirye akyogedde. We have made very significant steps. Naye nga steps ezo zikolebwa innovativeness. Kubanga ne wabanga waliwo abantu abajja okuyamba, olina okulaga obwetaavu ate n'ekizibu n'okiraga. So space eno nga mugiraba si nnene. Service providers and our mothers, amannya Damba Henry nze kawo wammwe, ndi musanyufu okubeera ku mukolo guno kubanga mukulu nnyo mu lugendo lwe tulimu okuwa services eri abantu bannayuganda. I want to register my gratefulness to Save the Children for supplementing government efforts in health delivery. Not only here, but I'm aware of enormous efforts we have made across the country to see that we improve in our health services. The government here is responsible to keep you healthy. Naye oluusi obwetaavu n'obusobozi byawukana. So there are always gaps, and these development partners come to fill those gaps. So we really thank you so much for filling those gaps. Njagala okwebaza n'abakulira eddwaliro.
We have witnessed the official handover of our neonatal intensive care unit, or Mukono General Hospital, the first of its kind in the modern era. Previously we had a Nicu, but it was situated in an improvised space which was not meeting the WHO requirements of a level 2 Nicu facility. Our development partners with the government, Save the Children, committed the funds which helped in refurbishing and equipping one of the existing staff houses that has been converted into a modern Nicu space using their funding. They have not only refurbished and equipped, but they have also offered training to our health workers. They've given them skills that will go a long way in saving and improving the quality of the babies who come with challenges. Some of them are premature deliveries, others get birth asphyxia, some get infections. The facility takes charge of babies from day 0 up to the second month of their life. Obuulyawo nga balowooza nti tulwawo bakolako kuba tebatuwadde ssente, oba n'abamu batuuka ku mbeera eyagala okunoonya omuntu gwe bawa ssente, obuulyawo nti banaabakolako mangu, naye nga si nkola yaffe ng'eddwaliro, wabula kwe kusoomoozebwa kwe tuyitamu. Ng'eddwaliro twateesa era ne tuteekateeka ne Chief Administrative Officer n'omusawo akulira ebyobulamu mu disitulikiti DHO nga nti waakiri mu mwaka gw'ebyensimbi guno n'ogujja tutumbule ku bungi bw'abasawo mu ddwaliro muno okuva ku bitundu 35 ku 100 waakiri okutuuka ku 50%. Kuba ensimbi ziyinza okuba teziriwo ezirikuutinga 100%, naye tekya 50% ndaba nga kisoboka mu myaka gy'ensimbi ebiri, 2025, 2026 ne 2026, 2027 kiyinza obuulyawo okuwulako ku wakalodi oba obuvunaanyizibwa obwa buli ssekinomu ku ffe. Preterm deliveries, birth asphyxia and infections are the leading cause of morbidity in the Nicu. But we advise that we start our antenatal quite early. Antenatal should be attended to as soon as you get to know that you are pregnant by testing your urine. We feel that at least in the first 8 weeks of life of pregnancy, one should start antenatal because there are drugs that mothers need, there are checkups that they do need, which can have a bearing on their pregnancy. And like folic acid prevent birth deformities like spina bifida and other neonatal conditions or congenital conditions. When we monitor the growth and the mother, we detect early problems like hypertension of pregnancy. Can also detect those that have got deformities, life-threatening deformities, and they may be advised otherwise. We also plan delivery for those with risks. Those with the complications are also managed early enough so that they get better outcomes at the end of their pregnancies.
Koja Health Center for, so that we reduce on the volume. Because when you look at the referrals we are making to Omuwendo, they are many, and of course they come with a cost in terms of transport and also human resources to support these babies during referral. So ladies and gentlemen, I don't have really much to say apart from welcoming you and thanking you for a lot of support. Now that we have the DG, as I conclude, the representative of the DG, in a bid to decongest this facility, we have noted that there are two facilities which we can upgrade from level 3 to level 4. And one of them is Goma, another one is Katogo. For Katogo, the infrastructure development has already been undertaken. What is remaining is the Ministry of Health to pronounce themselves that this is a health center 4, and then we are good to go. The equipments are there, human resources there. What is lacking is what? Is pronouncing that it is a health center 4, so that we increase on the budget for wage, we increase on the budget for drugs and medical supplies, and then we shall be ready to go. And that will imply that some of the patients who come to this facility, because it is the only referral center in the district, will have to be worked on from those other places of Goma and Koja Health Center 4. With those remarks, ladies and gentlemen, allow me that this post has been cleared by Ministry of Public Service. And the wages are available for that post. So I'm praying that as soon as recruitment starts, we should prioritize recruitment of a pediatrician for this facility. Because I noted in the past 6 months, we have lost over 117 babies in this facility. I'm not saying that if he was around, they wouldn't die. But when they die, when there is not a clinical person, it also becomes a bit funny. So 6 months, 117 babies have already passed on in this facility. So ladies and gentlemen, I don't need to speak much. What I need to commit is that we are committed as a department to ensure that maternal neonatal health services improve in the district, and also the emergency medical services. Currently, when it is not, if it is not motivated, of course they cannot work at the way how they are working. So the office of the CAO, we greatly appreciate you for ensuring that this team receives the salary before the end of the month. Of course, that is a very great motivator. I also note when it is not, if it is not motivated, of course they cannot work at the way how they are working. So the office of the CAO, we greatly appreciate you for ensuring that this team receives the salary before the end of the month. Of course, that is a very great motivator. I also note when it is not, if it is not motivated, of course they cannot work at the way how they are working. So the office of the CAO, we greatly appreciate you for ensuring that this team receives the salary before the end of the month. Of course, that is a very great motivator. I also note when it is not, if it is not motivated, of course they cannot work at the way how they are working. So the office of the CAO, we greatly appreciate you for ensuring that this team receives the salary before the end of the month. Of course, that is a very great motivator. I also note when it is not, if it is not motivated, of course they cannot work at the way how they are working. So the office of the CAO, we greatly appreciate you for ensuring that this team receives the salary before the end of the month. Of course, that is a very great motivator. I also note
as office of the president also we are going to be vigilant on that. Just within us, we had some challenges there and there, but we are trying to come up with a solution very soon. And I'm very sure after having organized ourselves, we shall have human resource in place. And even the CAO, I don't know whether we have some people who are doing work without being on payroll, the same work here. If they are there, I think we should just confirm them after applying. So that is it. Finally, the task ahead of us, especially the CAO and the team, is how to maintain the facility. So the facility is in the place, fully fledged, I may say, but now handling it is also another task. So let us do what is needed, make sure that we keep our facility given to us very well, and not only, as my colleague said, not only looking at the facility, but also the service itself. Let me hope that the appreciation to our health workers, it has been genuine, not for function. So if it is genuine, we thank God, and I want to thank you for that service you are giving. I know in the service you are giving, you have a lot of some of the challenges, but we thank God that we have challenges, not problems. So challenges can easily be managed, but sometimes problems are not easy to do what? To manage. So on the issue of human resource, here also the testimonies from our people, but I also got challenged that out of that life-saving testimonies, so as a person, I was challenged, and that's why I want to urge you to our health workers that when you are giving counseling, please, you should also call the husbands of such people to come and they be aside of their wives. Because such people who are giving testimonies, it would look good if their husbands were aside of them. So, as men, let us also check ourselves. Because those people, yes, because I'm sure that those children, they have fathers. They have fathers. So I got challenged, and I have been touched to see that the ladies are struggling to give testimonies, and even in their testimonies, I have not heard where the men come in to give a support. So really, it is a very, very big challenge. So I call upon my fellow men, the government, first of all, to accept working with any NGOs, because some countries, they don't allow any NGOs to work with them. But I want to thank the government, headed by His Excellency, the President of Uganda, who is newly elected, to accept working with NGOs. And the government also thought wise. Save the Children have stayed here for so long, but even during 2015, also government decided to bring out the act of PPP, public-private partnership. So under the aims of PP, that is to enable the NGOs or other private sector to participate in delivering some infrastructures and so on. So I'm happy that you are now on that theme of helping our country. Indeed, what you are doing is a big contribution to the government. Because the government would be in position of doing that, but because we have a lot to do, so we are happy that you have decided to come and do something for our people. You want also to inform you that you don't know how many souls you are going to save, and you have already saved some. So I was for the good work done. I know a lot has been said, but I want to thank the Dr. Kasirye and the team for being innovative and hardworking. Please, may you clap for them indeed. And for this case, let us also give a round of applause to Save the Children for the good work done.
I'm passionate about healthcare in Uganda, but particularly I'm passionate about Mukono General Hospital as an individual and as a health worker. I have been here before, and Dr. Kasirye, we've interfaced a few times. I remember when I visited, we had come for a support supervision with other members of top management in 2014. I was straight away sent to the neonatal unit by virtue of my my expertise. I went to that room, the radiology room, and my heart broke. I was so heartbroken. I remember during the feedback meeting, I gave my feedback with a lot of pain. And today, there is, we've registered a milestone towards the right direction. I was here 1 month ago, and I visited the refurbished unit. I was so happy. I left this place very happy. Of course, I had come, following up on sickle cell interventions, and I must commend the facility for what you're doing in regards to sickle cell prevention, diagnosis, and treatment. You are doing a great job. And the other aspects of the facility, like we heard from the head of the maternal child health section, we are delivering up to 90 mothers a month? 90 per month. 900. Wow. 30 per day. That is huge. And we get this data at the center. Of course, when I computed, it comes to about 1,000 or so in a year. 1,000 deliveries, 10,000 deliveries. And what we had captured was about 64,000 from our DHIS to 6,400. But I realized that the data on ground is actually giving us bigger numbers. And this is really huge. And now you can see that I have reasons why I am passionate about this general hospital. It's one of the busiest facilities around the country, at least in the government facilities. And we, like it has already been mentioned, the Ministry of Health is discussing behind closed doors, and we have also spelled it out to you that we are planning a complete overhaul of the infrastructure of this hospital so that it can serve the community better. I remember 1 month ago when I visited Dr. Kasirye, we discussed this, and I followed up some other ways that are being considered of refurbishing this hospital. And we will continue to advocate. I must say that even the accounting office at Ministry of Health has this facility at heart. For any opportunity that will surface anytime soon, and those that are underway, you will soon see a difference in this facility. We all have you at heart. And I want to commend in a special way the leadership of this facility. You're doing tremendous work. For us at Ministry of Health, we know that if a facility has good leadership and governance, we are good. And Dr. Kasirye and team, thumbs up to you. You have done well. We will do our part to support the facility, and we also urge our partners to continue to support us. As a pediatrician
and members of the community. My name is Rachel Hopkins. I'm the Programme Development and Quality Director with Save the Children, and I'm here today representing our Country Director. It's a privilege to be here with you all today. All of you are in one way or another contributing to the well-being and health of children and community. Feel their rights to a healthy start in life, the opportunity to learn, and to be protected from harm. We deliver programs in health, education, child protection, and food security and livelihoods, working in partnership with the government, communities, civil society, and the private sector to create lasting impact, inspire change, and uphold children's rights. Today, I would like us to reflect on a journey. Not the journey of a building or the journey of an organization, but the journey of a newborn child. A newborn's journey begins with hope. Hope in a mother who has carried their pregnancy for hope in a father who dreams of the future, and hope in a health system that promises safe delivery and quality care. But for some newborns, that journey begins with vulnerability. A baby born too soon, a baby born too small, or a baby struggling to take that first breath. In those first minutes, everything matters. Warmth matters, oxygen matters, functional equipment matters, a prepared facility matters, and as we've just heard from our mothers, a knowledgeable and dedicated health workforce matters. Is why we are here today. This renovated neonatal care unit at Mukono General Hospital represents far more than walls freshly painted or equipment installed. It represents a strengthened link in the chain of survival for newborns in this district and beyond. This neonatal unit, which also houses the oxygen manifold system, will serve the population of Mukono, given that Mukono General Hospital alone contributes to almost 10,000 deliveries a year. Save the Children has a long history of working with communities and forming strong partnerships to strengthen health systems and ultimately to improve the outcomes of children and their families. Since 1959, across Uganda, in both development and humanitarian settings, we have been committed to improving maternal and newborn health in collaboration with the Ministry of Health, academic institutions, service providers, professional bodies, and communities with whom we work to co-design, implement, and evaluate our programs. We mark a turning point. This health facility now has enhanced capacity to provide quality newborn care, specifically level 2 care according to Ministry of Health guidelines for neonatal units. A bed capacity of 15 has been created to cater for the demand for these services from both public and private health facilities, and as we've heard, to reduce unnecessary referrals to tertiary level care, especially to Kawempe National Referral Hospital. This has been made possible through investment in health worker training and mentorship, clinical decision support using innovations such as PRISMs, and a ventilation simulation tool, the Augmented Infant Resuscitator, complemented by the provision of life-saving equipment for newborn care. The launch of this neonatal care unit is a milestone, but it is also a call to action. It is a call to continue investing in maternal and newborn health. It is a call to strengthen referral systems, a call to equip and mentor health workers continuously, and a call to ensure that no baby is left behind because of where or when they are born. On behalf of Save the Children, I reaffirm our commitment to working closely with the Government of Uganda, and I extend my appreciation to the leadership and efforts made by the Ministry of Health, the Mukono District leadership, the hospital management, and all of the health workers, towards ensuring that children's rights are fulfilled and that they are safe and healthy.